International Day for the Elimination of Violence Against Women and Human Rights Day, calling for the prevention and elimination of violence against women and girls in all their diversity. This year, the theme is Orange the World, Unite, Activism to End Violence Against Women and Girls, drawing attention to the role each and every one of us has to advocate for change. Violence against women, particularly intimate partner violence and sexual violence, is a major public health and clinical health problem and a violation of women's human rights. It is rooted in and perpetuates gender inequalities. Globally, 1 in 3 women experience physical and/or sexual violence in their lifetime, mostly by an intimate partner. Worldwide, almost 1/3 of women, 27%, women aged 15 to 49 years who have been in a relationship report that they have been subjected to some form of physical and/or sexual violence by their intimate partner. And this does not end as they age. This is a stark reminder of the scale of gender inequality and discrimination against women. The United Nations defines violence against women as any act of gender-based violence that results in or is likely to result in physical, sexual, or mental harm or suffering to women, including threats of such acts, coercion, or arbitrary deprivation of liberty, whether occurring in public or in private life. Intimate partner violence refers to behavior by an intimate partner or ex-partner that causes physical, sexual, or psychological harm, including physical aggression, sexual coercion, psychological abuse, and controlling behaviors. The health impacts of violence, particularly in intimate partner domestic violence on women and their children, which also includes boys, those acts are significant. But violence against women can result in injuries and serious physical, mental, sexual, and reproductive health problems, including sexually transmitted infections, HIV, and unplanned pregnancies. Violence against women tends to increase during every type of emergency, including pandemics, as the one we are presently suffering, and continues to be seen during this ongoing pandemic. Stress, the disruption of social and protective networks, and decreased access to services can all exacerbate the risk of violence for women. Older women and women with disabilities are likely to have additional risks and needs. Women who are displaced, refugees, and those living in conflict-affected areas worldwide are particularly vulnerable. Distancing measures that needed to be put in place and encouraging persons to stay at home during the pandemic unfortunately also increased the risk of violence. But we know violence against women is preventable and its consequences can be mitigated, as the mayor pointed out. The health sector has an important role to play to provide comprehensive health care to women subjected to violence, and as an entry point for referring women to other support services they may need. As PAHO WHO, we advocate for timely access to quality health services for all survivors of violence. Health providers need to be aware of the risks and health consequences of violence against women. They can help women who disclose by offering first-line support and medical treatment. First-line support includes listening empathetically and without judgment, inquiring about needs and concerns, validating survivors' experiences and feelings, enhancing safety, and connecting survivors to support services. The use of telemedicine in safety, using this as a method of addressing violence, is also an important tool. COVID-19 has shown both the uses of telemedicine and the increased urgency for action to expand this method of reaching and delivering services. We are pleased to say that PAHO WHO has been taking action in several of these areas through additional support. Under a European Union-supported Spotlight initiative, which is being implemented globally and in collaboration with the Ministry of Health, we have worked with the Ministry to develop national policy and clinical guidelines on interpartner violence and sexual violence that was based on international protocols but adapted for the Trinidad and Tobago context, as well as a train-the-trainer program for healthcare workers in each of the 5 regional health authorities to prepare them to provide the best quality care. In fact, next week, Trinidad and Tobago will be the only country in the Americas presenting this work that was done to all of the Americas. In addition, with funding from the UN-India Partnership Development Fund and the US government project USA Pledge, we have also been expanding services by the provision of telemedicine equipment to all five of the regional health authorities, and will be providing all necessary training to accomplish it. Finally, we have created an add-on to the existing perinatal information system developed by PAHO, and the perinatal period covers the period from 22 completed weeks of pregnancy until 7 completed days after birth. This information system, for the first time in Trinidad and Tobago, and again in the Americas, will allow the public health system to capture data on violence against women and girls during this period. But the system will not only capture data, but store and analyze the burden of problems and interventions and outcomes of health services at the local level. It is the first addition by PAHO to the existing perinatal information system for women and girls in the Caribbean, which is so important during this vulnerable period of their pregnancy and birth. In closing, I wish to re-emphasize that the 16 days of activism are a timely opportunity to raise awareness for the health and social consequences of violence in our communities, as well as strengthen our commitment to collective action. As in the region of the Americas, we come together to build back better. We must strengthen action to both prevent and respond to violence against women and girls, as well as boys and men in our community. Again, I wish to congratulate the Lions Club of Santa Rosa for raising awareness of this critical issue. And once again, I also thank you for inviting PAHO WHO to be a part of this. This is something that is very close to our heart, and we commend you for your work. Thank you.